welcome to my home and happy Monday as we start another phenomenal conversation with moms around the world, some expecting, some moms just gave birth, and we've built this community with the USO, and I'm so honored to be part of this phenomenal Zoom conversation. I know that we are also, hi, I'm Tamron Hall. I didn't even start with introducing myself. I feel like we're old friends by now, as we've had a few of these great conversations surrounding the motherhood juggle and how real it is for all of us here. My father was in the Army for nearly 30 years, so my affection and love for military families is real, as it is a part of my journey as well. I also happen to be a mom of a 15-month-old who I can hear rolling some kind of gadget or something above my head. My son Moses just turned 15 months. He is walking, he is talking, and he's a handful. You might notice that my hair is a bit different than it was on the flyer. Good morning, Tori Peterson. And my hair is a bit different than it is on the photo that they showed promoting this, because the motherhood juggle is real. I did not have time this morning to straighten my hair. It was just not going to happen with everything that I was experiencing today. So I'm sure many of you at home right now watching or in a cozy place know that this is about shedding our layers. This is about not being held back by the masks that we as moms often put on just to function and to make it through the day. This is about tearing off those masks and showing the vulnerability that is just a part of this journey, and getting answers and advice from other moms who are experiencing the same thing. I keep saying in this series, you're not alone. The motherhood juggle, our goal is to connect to one another, and to show that the challenges that you are facing right now, yes, that you are not alone in this. I want to introduce our panelists for today. We have some moms who will join us as well from around the country, but we also have some experts who will join this conversation and share with you creative ideas to meet the challenges that you are likely facing or will face. Let me first introduce the woman who originated this program, Marla Ryan. Marla is the president of Motherhood Maternity. Marla, are you there?
I'm here. Good morning,
Hi,
Tamron.
how are you? Good to see you.
I'm well. How are you?
I'm doing okay. You know what? All things considered, I'm doing all right. I got to ask you about this series. I mean, supporting pregnant women right now, as I've shared with others on our Zooms that we've had, I would have been pregnant during this pandemic if this were 1 year ago. You know, I had Moses April 24th. It's at the height of all of the shelters in place. Now you have women from around the world, military spouses who are looking at isolation, a need for community, a need to feel normal in an abnormal time. Why was this important for you?
Well, at the beginning of it, we really felt that this was something that we've always done, which is support our mom community. And during this pandemic, even more important given the isolation. We found with some internal colleagues that they were struggling with how to get through their journey. There were new situations coming up, whether it was going to a virtual doctor's appointment, fear of having to go to the hospital alone, as there were partner restrictions early on. And we just felt more content and information out there could help our mom community and really help everyone feel like they had an ear to listen to and someone to ask questions. Yeah. And that's kind of why we did it. We just think it's so important that we foster this community. And as we're coming through this, we're understanding that there are situations like when you're in the military that you are isolated 24/7. It isn't just a pandemic. And so we understood that this could really help people beyond just the pandemic.
Well, I think it's wonderful. And as I said, it's an honor to participate in this as a mom, as a woman, as a person who, like everyone else, is trying to understand what all of this means and how we move forward. We look forward to, speaking of, talking to you more a little bit later. But Marla, thank you again for being an advocate for mothers and advocating that we open up to each other more. Thank you.
Thank you.
All right, so August is Breastfeeding Awareness Month. So we're dedicating this part of our series to the topic of feeding our babies. in whatever way is best for us. And I'll tell you my personal story in a second, and it does include crying in the middle of a Target parking lot. True story. Now, there are so many different things to consider when deciding how to feed our newborns. Some within our control, others, as you know and will know, it's beyond your control. No matter what you do, there's a part of your body that has a mind of its own, so to speak. And so we have moms here to share their stories, and we want you to share your story as well. So you can look at the Zoom Q&A. I have it right here at the bottom of my screen. Please send your questions. Indicate if you are live. Just put the word live behind your question, and we'll work to read as many of your chats as possible. That's a great part of what Marla and her team has done. We wanted this to be accessible and a continued conversation. So head on over to the Zoom Q&A chat and let us know where you're from. And if you have a question, put live on there as well, and we'll get to that. So enjoy this conversation and feel free to be part of this. You're not a witness, you're a participant, and we want you to feel that energy. We have some experts with us, two of them, and let me bring them in. Ronnie Vehemente is a licensed clinical social worker trained at Columbia University for 25 years of counseling women and their families. Her practice is called the Family Room, where she focuses on the challenges of parenting, marriage, and family life. Ronnie, thank you so much for joining us. Let's talk about this, because this one, we have a lot of difficult topics that we've hit in this series. This one for me is the one that brings me to tears because so much of it is out of our control. Why do you believe that this is a top priority discussion right now in particular?
I mean, self-care is a priority because many women just in general struggle with, making time to take care of themselves. And this can be especially true for new moms. And, caregivers put, their needs above everyone else's. But somebody needs to take care of the caregiver, and someone needs to mother the mother, and that someone can be you. And, self-care isn't selfish. It isn't a luxury. It is an absolute necessity to take care of all parts of you, physical, mental, emotional, spiritual, because it's really about self-preservation. Because without it, then moms can feel overwhelmingly stressed, depleted, burnt out, and that can lead to, anxiety, depression, physical illness, and, that impacts your well-being and your babies. So it's really, when you take care of yourself, then you can take care of baby with more presence and patience and joy.
I said it brings me to tears because what you are saying in your wisdom and your study and your education is not new, but our acceptance and implementation of it is the challenge. I mean, listen, I'm from the South, and there's a saying, well, mama's happy, everybody's happy, and then there's probably a more intellectual version of that you can share from your studies. So we know it. I remember, 25 years ago watching the Oprah show, and there's this book, and, Oprah's like, you got to take care of yourself. And everyone got mad at her because she's not a mom, and you don't understand. It's there. It's in the research. It's in our hearts. Yeah. But we still stand in our way of self-care.
Yeah. So much of that is mommy guilt. So much of it is so hard to ask for help. So much of it is unrealistic expectations of what we should be doing and having to do it by ourselves 100% of the time, 100% well. And so it can be very hard for mamas to be vulnerable and to ask for help and to share how the honest experience of being a mother. But again, it is true, it's the oxygen mask metaphor. You got to put on your oxygen mask first before you can take care of anybody else, and so much so with a baby.
With the baby, the personal choice of how to feed the baby is another one. And it is one that comes with such judgment, and people are assertive and all kinds of things when it comes to this. Why is this, again, such a difficult conversation for moms?
Because moms feel judged by so many people. Moms judge themselves, right? And it's challenging enough being a mother. and even more so when you're feeling judged. And judging can lead moms to feel so much more vulnerable and isolated and alone. And, you know, like so many other things in parenting, there is no one right way of doing things. You know, there's no one right way of being a mom. We all share the same purpose. We want to keep our kids safe, and we want to love them unconditionally and raise compassionate, resilient, confident human beings. And, you know, there's no one right way of feeding your baby. And how you feed your baby is ultimately what works best for you and your family. So whether you breastfeed exclusively, formula feed exclusively, or a combination of both, you are nourishing your baby. And that's what's important. And I hope that as mamas, you feel confident in your choices and you trust your intuition, because that's what it comes down to a lot of the time.
Well, I'll be honest with you. I did not feel confident in my choice. I felt judged in my choice. I felt I failed. And here I am, you know, doing television for 100 years. And I've done this segment, and I've done the studies and the research and all of this as a journalist. And the day that I could not produce enough milk for my child, I felt, and by the way, I'd said to myself prior to giving birth, you know what, I'm going to listen to people like Ronnie and Beth who's coming up, and I'm not going to judge myself by this. As long as my child is nourished, I'll be okay. And the minute I couldn't breastfeed, all of that great advice that you and other experts like Beth, who's going to join us, given, fell out of the window. And I ended up in a parking lot of Target crying over the fact that I had to go in and buy formula. I want to bring in, I've referenced her already, Beth Lovinelli is the founder of the Baby Waitress, an online lactation and postpartum support service. She has over 27 years of experience as a maternal-child health nurse and is a board-certified lactation consultant. Beth, thank you so much for joining us.
Thank you so much for having me, Tamron.
Let me get you to join in on the conversation with Ronnie. What are some of the things to consider when you're deciding if you should breastfeed? If you're in the early stage, if you've not tried yet and you don't know the results, but you're trying to make the decision on the path ahead?
Well, I think something really important to keep in mind is that it's a choice, and that a lot of women do feel pressure. So the choice to breastfeed shouldn't be because someone else thinks that you should. I think it's important for mommies to make that choice themselves. And, you know, obviously a lot of women choose breastfeeding for their babies because of the health benefits. Everybody knows that it's a healthy option, but, you know, it can be challenging, as you well know. You've been in the trenches yourself. And sometimes our vision of what it might be and the reality of it, that having both of those things to kind of deal with, it's hard to wrap your brain around it sometimes. But I always say that mothers spelled Guilty, you know, anything that doesn't go quite right, mothers are quick to blame themselves. Yeah. And so a lot of, in my own practice, I do spend a lot of time working with moms, helping them to understand that however you feed your baby, 100% direct breastfeeding isn't the ultimate, you know, definition of success. For some women that is, but for some women, it's a combination of breastfeeding and formula feeding, or for some women because of physiologic reasons, emotional reasons, logistical reasons. You know, there's a lot of reasons why it may not work. And I think coming to terms with that is really important, but having someone help you sort through that and talk it out is super, super important, because you can get into a vacuum with yourself.
Well, and that's your point, and that's what we want to do. We want to make sure that we talk it out, especially with this great group. I'm looking at some of the moms who are from everywhere on here, and understanding the choice, and that it is certainly something that we can fall into the guilt trap with. So I want to start with that. You know, if a woman decides to breastfeed, how can she best prepare prior to birth?
Well, I think it's really important to kind of do a little research. Unfortunately, there is so much information online that a lot of women just get overwhelmed. A lot of the women that I'm working with now are some of the smartest most well-researched. They can list different websites and different things and research studies. But I think it's important to find maybe a lactation consultant that you can take a prenatal class with beforehand to get some information. I think it's important to talk to your pediatrician to find out what kind of lactation support they might offer in their office, and to see how supportive and educated they are in supporting breastfeeding mothers. And I think it's important to keep in your mindset the flexibility, similar to how women are coached about going into labor. Be flexible. The outcome is that we want to see is a healthy and happy mommy and baby, whether it's in labor or whether it's how you feed your baby. So I think the flexible mindset is helpful in motherhood.
I think, and by flexibility, I mean, I just saw a question about formula, how to pick the best formula. You know, again, being a journalist for so many years and reporting on, well, it's healthier for your baby if you have breast milk. I do, and I have felt guilty as a journalist, because that doesn't mean that you will have an unhealthy baby if the child has formula. Exactly. And a lot of moms are made to feel that way, just exactly. Even in reporting in the media, that yeah. If you have a child who's on breast milk, they're going to go off to Harvard and they'll take care of the family forever. Yeah. Meanwhile, that formula baby will be left behind. Yeah. And that's not what the science or research says.
Yes, that can be very difficult, hearing all these different messages. You know, moms that make the decision to either exclusively formula feed or need to use formula because of a disconnect with milk production should never be made to feel guilty or shamed. And I don't think any lactation consultant, if they do, shame on them, but should do that. But I think it's important, if a mom is struggling with milk production, to really explore what's happening. And, I always tell moms, it's the baby's job to tell your body how much milk to make. Most moms say, I didn't make enough milk, when really it's a dance. And if there's something going on with the baby's mouth, if the baby was born a little early, if there was some issue where the baby could not latch and give your body the right kind of memo, if you will, then so that can sometimes be the reason. And sometimes understanding that can help a mom take the guilt off herself. Yeah. It wasn't my body that didn't do it. Somehow we just didn't connect on a purely physical level. So.
But even honestly, hearing that could cause, Ronnie, an emotional reaction to hear that, okay, me and my child didn't physiologically connect, because in our minds, everything about this experience with this little one coming out of me, I am his or her connection.
Yeah.
And so Ronnie, it brings me to the question about, which I saw someone just say it in our Q&A, the vulnerability of feeling that now your whole job is feeding the baby, especially when you have another child in the home. I remember the first couple of weeks of breastfeeding my son, I thought, okay, this is my whole existence. On, off, on, off. I know that was a graphic example, but that's what my life felt like, knowing that I had to go to work. And I thought, I can't imagine having a 2-year-old or a 4-year-old while, this on, off mechanism is happening around me, and how that must affect you emotionally, because it's a lot, even when you can produce the proper amount to sustain your child's diet. Emotionally, Ronnie, what it's doing to you.
A feeling of overwhelm, stress, not being good enough, not being enough, not being able to give enough to 1 child, 2, 3. It can, make a mom feel like she's failing, rather than, celebrating all that your body is doing, that you created this life, that you are taking care of these human beings. And so many, moms and, women are wired to really just focus on the negative, and rather than celebrating all the positive. And it can kind of, like, Beth said, really create this vacuum. So it's really important to notice and appreciate all the positives, and to really be grateful
And having agency, Beth. I'm looking at a note now, a comment from Kristen Horton, one of our attendees. She said, I breastfed my daughter till she was 14 months while active duty. Don't let your chain of command stop you or make you feel bad for pumping. It's right for you. And she said she plans to do the same for her son, who is due in September.
Mm-hmm. That, yeah, you know, there's so many different, every woman is individual. Every situation is individual. Every woman's, you know, I mean, working in active duty and continuing to breastfeed, that's, you know, that's amazing.
Amazing. It's amazing.
It is amazing. And in the point that she made of it is, you're right. There are some women who have challenges logistically with careers, the types of jobs they have, finding the time or the ability to be able to pump while they're working. I've worked with women that are, you know, teachers, nurses, doctors. I worked with a woman who was a professional golfer. I worked with a woman who was in construction. So each job presents its own unique challenges for continuing beyond, you know, once a mom is back to work.
Absolutely. And moms who are, you know, we don't use on my show, we don't say, you know, stay at home moms. We say work at home moms, because you're working at home. And I'm looking at a comment right now from a mom who said, you know, trying to balance nursing and attending to other two children while doing a virtual teaching second grade class. I mean, you have that very real life situation, which goes back to, Beth, what you and Ronnie are talking about, the balance of it all and not feeling the guilt of completely abandoning one situation for the other.
Yeah. Yeah. And I think, you know, lining up support where you can get it. You know, I've been doing a lot of virtual visit calls with moms, and I've literally seen a mom baby wearing and saying, just a minute, I've got to go help my 8-year-old who's on a virtual classroom. So, you know, this particular group of moms, you know, in times of COVID, have another layer of unique challenges. But I think it's all about support. It's all about looking at glass half full. It's all about knowing that you nurture and love your baby. At the end of the day, no matter how you feed your baby, you're loving and caring for them and keeping them safe and happy.
Speaking of the times that we're in, Ronnie, how much does stress play a role in being able to breastfeed and or Beth, answering this question, the role that stress plays into it? And obviously stress is, we can't escape it. We're in a pandemic and we're dealing with it and seeing it all day long. But do you have some advice once the baby's home and you're trying to feed your child through breastfeeding? Beth, go ahead.
So just to clarify, I thought that you were directing it at Ronnie. I'm sorry, I was
no worries.
Paying attention to the question. So just being flexible, looking for support, you know, understanding the uniqueness of this time, that moms have some kind of extra stress and challenges because of what's happening. But there is support out there for moms. As everyone has pivoted to the virtual world. So for a mom that's finding challenges, looking for new moms groups online, friends that they can get on the phone with, that they can text with, that they can get on a Zoom call with and share their challenges, can be very, very helpful. Especially in the early, you know, first couple months. Those are the kind of in the trenches kind of part of new motherhood, when support from other women and from family and friends are really key.
Ronnie, I know you focus on parenting, marriage, and family life. We talk a lot about the support system, and we say things like family or friends, but your significant other, your spouse, while they may not be able to breastfeed, they are a part of the ride too. Yes. And explaining that to your significant other. We have a funny picture of my husband took of me. He thought it was funny, of me with the breast pump on, a scarf on my head, the baby. And I said, that's funny to you. Not funny to me, bro. Not funny to me. But, you know, ripping off, some of the stigmas that we put on ourselves about not looking our perfect, way, while my husband is snapping a photo that I'm going to sue him that he now owns.
Oh, so many things can change, when baby comes round, and, the significance, of having your partner as your parenting partner. So really, having lots of conversations with your partner about how to share baby care, how to share middle of the night wakings and household responsibilities, so it feels, so much more balanced and grounded in a shared, parenting experience, rather than feeling like it's mostly mama's responsibility.
Because it physically is, but emotionally it doesn't have to be.
I mean, again, when I became a mom, I was just blown away about not only how physically demanding it is, but certainly what an emotional experience that I wasn't prepared for. So the emotionality of it can be so terrifying, at times. And, being able to talk to, other moms, and certainly to talk to your partner about your experiences in a very, authentic, open kind of way, because then it creates a sense of, connection and community, and you feel less alone.
Speaking of our community, let's bring in some of the moms who are standing by. We have our first mom joining us from Aviano Air Base in Italy. She has a 3-month-old baby. Chrissy, are you there? You standing by? Hi, Chrissy.
Hi, ciao from Italy.
Ciao, Bella, ciao. Let me ask you, this is your second child, and your plan was to breastfeed.
Yes, I gave birth last May to a bouncing baby boy. His name is Chance Elijah, and he's my second one, and my firstborn is already 18 years old. So that's a very
what? That was a flash. I was like, what?
Yeah, that's a very, very big age gap. So
yes. Well, you've got a babysitter. You have a built-in babysitter.
A free one, which is the most important. Yeah. So.
And you tell me, you had an experience that affected breastfeeding. Tell me about it.
Yeah, so at the onset of my pregnancy, I already decided and I planned on breastfeeding, because I wasn't able to breastfeed with my firstborn because I was young. I didn't know what to do because I was 19 years old that time. So, but now that I'm older and claim to be wiser, I said, okay, I'm going to do everything perfectly this time. So I planned on breastfeeding. I had my nursing tops, I have my breast pump ready, my milk bags and all. And then I ended up stopping like after just 2 weeks, because I have developed a condition that I realized not a lot of people are familiar with. It's DMER, or dysphoric milk ejection reflex. So it was, yeah.
Wow. So Beth, tell me. Beth, can you explain to our audience what that is, Beth?
Yes. So DMER, as she had just stated, is, as Chrissy said, is dysphoric milk ejection reflex. And dysphoria is a change in mood. And it's really a physiologic response. So when a mom's breasts are stimulated and the milk is about to let down, there's a shift in hormones. And dopamine, the dopamine hormone, can drop. It lowers naturally, but for women that experience this, it's a big drop. It's a big plummet. And when there's this big drop in dopamine, it can cause changes in mood for moms. There's a wide range of moms' experiences, from mild to severe. Some moms describe it as, and it's rare, but we're unclear because there's still a lot of research, and it was really just not clearly defined until I think about 2008. Women started Googling and searching for feeling sad with breastfeeding, some women describe it as a pit in their stomach, feeling hopeless, feeling like a big dark cloud has come over their head. And it's very short. It's very brief. It's as quick as seconds for some moms. and it comes back. But for a lot of moms who don't know what it is, and Chrissy, I know obviously now you know what it is, it doesn't make the symptoms go away, but it helps moms understand that it's not something that's wrong, because a lot of moms feel like a bad mother, like, why do I feel so bad? I don't like breastfeeding. And you may not like breastfeeding because of this physiologic response to the way that your body responds. And
how common is this?
It's not that common. Although in my practice where I'm seeing more moms, I think the guess right now could be somewhere between 8 and 10%. I could be a little bit off with those numbers, but there's a lot more research that needs to be done. And I think it's really important for discussions such as this for moms to talk about it. And Chrissy, that you're sharing this is really helpful, because I worked with a mom once, I'll make this brief, but I worked with a mom once who it was her second child. And she had some issues where she needed to do a combination of nursing and pumping. And she came back for a follow-up visit and she said to me, I don't want to pump anymore. I hate pumping. And she said it was such, intensity that I said, tell me more. And she said, I just feel awful. And, and we discovered, and she didn't know, so she had breastfed her first child for an entire year without understanding that that's what it was. And many moms, when they understand it, feel like it doesn't make the symptoms feel any less intense, but there's a name to it, and they know that it's short term, and there's a lot of women around the world who are coming together to support each other.
Right. And now, Chrissy, how are you caring for your mental health with so much going?
You know what? It was confusing for me at first, because just to give you a brief history, so I gave birth the 3rd of May, and that was during this time of, the COVID pandemic, and my husband was allowed to be there for labor delivery, and after 2 hours he was sent home, and he was told that you can come back when your wife's going to be discharged. So I was there by myself with a 4 or 5 incision on my belly with this crying baby, and I didn't know what to do. And the day after that, my mom passed away. So I was disoriented. I didn't know what to do. I feel like just if my husband was just there, if my 18-year-old was just there, it would have been easier. Because how can you celebrate life when there's death, and it's just probably the most important part in my life. So I didn't know if it's DMER or I don't know if it's postpartum, but it was one of the most difficult time. And then, so 2 weeks, I was feeling that every time I pump, every time I touch my breast, every time I nurse, there's just this very, very dark emotion that just, it just dawns on me, and it lasts for like a minute or two, and then it goes away. But then I told myself, I can't keep doing this. And of course, the baby's still small, like you have to feed or pump every 2 hours. So every 2 hours, I have to feel this emotions, and it's just too much for me. And then good thing that here in Aviano, we have the new parent support program, and we have like a nurse counselor that before it was virtual, and then she was able to visit me at home 2 weeks after I gave birth. And it took me a lot of courage to tell her, to admit. And I said, I'm feeling this, and I can't even tell my husband.
Yeah. Ronnie, I think Chrissy may have frozen, but hearing her story and knowing that there are other women on here who may not have. Are you there? Ronnie?
Yes.
Okay. I think we had a little complication with Chrissy, but you just heard her story there, and knowing that that's her particular and heartbreaking set of circumstances, that sense of pain at this joyous time of your life. I can't open up
because I feel like
I think so when you hear that, Ronnie, what's your reaction?
Oh, it's so heartbreaking, when, like she said, this is a time to celebrate when you have a baby and, under these circumstances alone, without your partner and without your older child and now without your own mama. So there's so much, loss that can come along with becoming a mother. And when it is just amplified by the loss of your own, it creates so much grief, just grieving, not being able to say goodbye to her own mother. And it can really just create so much of a sense of loneliness and isolation and such sadness and despair. So, I'm so thrilled to hear that where she is, she has a new mother support group to rely on, because that's when she needs it most. That's when moms need it most, to really be with a community of mothers who are, going through the same thing, to feel the support and to feel connected. Especially, each mother has their own story, right? Of all kinds of struggles. We never know. So to be able to have a place or to have just one person, and so for her not to feel like she could talk to her own husband, again, just makes your world so small, when your world can be so much larger and full of, love and life.
Even in these circumstances where we have to socially distance. I mean, here we all are with people around the world. Beth, you have a key philosophy, mother's mental health over mother's milk. Explain that.
Well, obviously, as a lactation consultant, we try to support and promote breastfeeding as much as we can. But when we see that a mother is experiencing something like DMER, which again is more rare. So, but other issues, other life stressors surrounding breastfeeding, that for that particular mom is making it really difficult. I had a mom the other day that I was chatting with, and she said that she felt the pumping was taking time away from her baby, that she was tired, that even napping was taking time away from her baby. So basically, we always do a mental health check-in with any mom to see where they are. And if a mom is feeling so stressed out or so anxious, and there's nothing we can do to reframe the plan or make things kind of easier, we always encourage moms to again, put themselves first. So if that means I
have a couple of questions that I'm looking at from moms here, and I'll just shoot through some of them, and Ronnie, you and Beth, answer it well. This one, is it still suggested to hit the 1-year mark when breastfeeding?
So the World Health Organization encourages moms to try to breastfeed, provide breast milk for a year. 6 months is a great goal. A year they encourage. But again, I always tell the mommies I work with, any amount of breast milk you provide your baby is a win. It's always a win. So feeling the pressure of that year, if you can't make it to a year, you still yay for you for doing any breastfeeding. But that is the current recommendation. Yes.
Ronnie, I'll send this next one to you. It says from Emily Barber, Virginia Beach, Virginia. I'm 4 weeks postpartum via C-section, having a hard time with body image. I can't seem to look at myself right now. Will this feeling ever go away? Well, before you answer, I'll tell you, 15 months later, I look at that scar and I'm like, the doctor lied to me. It is much bigger than I thought it was going to be. You lied. I've used creams. I've used silicones. I'm like, you lied, doctor, you lied. But I now know that that's probably in my head. But I look at my body, and you know what, if it's not in my head, and if it is as big as it looks like it is in the mirror, I gotta live with it. I look at my son, and occasionally when I want leverage over my husband, I say, this came from my body. This is, but I have personally tried to find humor in it, to be honest with you. And I also realize I'm in TV, so I live my life from here up, and nobody has to see from there now. But how do you balance that, especially when, yes, we know that the body image conversation has advanced as it relates to moms, but I'm on social media. And when I see people being applauded for their snapback game, and I know that that picture was completely altered through digitation, digital witchcraft, as I call it. In fact, I forbid my team from putting that in a script. There was a celebrity on a social media famous mom on one of the Housewives show, and the question said, "Talk to me about your snapback game." And I said, I am not going to do that because that is unnecessary and false pressure. But how do you balance it when you're looking at your body and it's not matching up?
I think it comes to radical acceptance, really. Really owning and celebrating what your body just did. Whatever it looked like. I mean, so much of our birth stories and mothering stories are very different from, what we imagine. And so whether that C-section was planned or not, it can be a reminder of what didn't happen the way that you thought it would.
Right.
And to, again, embrace your body's capacities and the fact that you created this human life, and that you are taking care of this little miracle. And that scar, for you, Tamron, as well, is a badge of honor. It isn't, a badge of shame. But, I hope that you do take time to really explore what those feelings mean, and to cry when you feel like crying, and also, acknowledge how far that you've come, and know that this too shall pass. That one day, when you look at yourself, you acknowledge the beauty that there is in being a woman, and that we as women have this capacity that only we can birth babies. And what an amazing, gift that is.
It is that. I want to bring in another mom to the conversation, Victoria, joining us from Bavaria, Germany. Victoria, are you there?
I'm here. Hello.
Hi. Oh, we see you brought a beautiful guest with you. We love that.
I did. Can you say hello?
Oh my God. Listen, you just upstaged the whole show. Ronnie and Beth are the experts, but here you are.
Get it. She's
You have what's her name?
Hannah.
Hannah.
Hannah. Mm-hmm.
Hi. Oh my gosh, look at those curls and the cheeks. Hi. Oh. And how old is Hannah?
She's almost 18 months.
Almost 18 months. This is you have your second pregnancy now.
Yep. Mm-hmm.
How's it going?
Pretty good so far. I took a little spill last week at the pool, so that was everything's 100% fine. We're all good. But it was like one of those moments where you're like, is this a defining moment in my life? Yeah. But everything is fine. So other than that, it's been pretty smooth sailing.
Tell me about your breastfeeding journey with your daughter, with Hannah. What was that like for you?
So it was really, honestly, it was a lot harder than I thought it was going to be. I feel like nothing really prepares you. I don't know. I thought it was beautiful and it was awesome in certain areas, but it was really difficult, really hard, and really emotional in a lot of others. We really struggled in the beginning with latch and painful nursing, and I just didn't know any differently that wasn't normal. And so
now, as I understand it, you felt that your doctor wasn't listening to your concerns, and you had to follow your instincts.
Yeah, so Hannah was born at 52nd percentile for weight, and by her week or whatever after birth, she was down to 6%. And I was like, hey, whoa, what is going on? And they're like, oh, it's totally normal, as long as she's still eating, as long as she's still nursing. And I had a lot of questions. She was nursing around the clock. She obviously was really painful while we were nursing. And, there's a huge gap between when you're seen. It's a 2-week appointment and then a 2-month appointment.
Yeah.
And I took her in a couple of times in between that, just not feeling like something wasn't right. And she got down to the 2% for weight and then down to the 1%. And I know you're not supposed to compare other babies, but I was looking at other babies her age, and I'm like, she's a peanut. she's so tiny and like just doesn't have a lot of body fat. And I don't know, I didn't feel like it was right. And so,
and what was going on? You learned that your instincts were right. It wasn't right. What was going on?
She had a tongue and a lip tie, which we didn't actually know about her lip tie till we went to get her tongue tie revised. But I had asked her, because, you know, at that point I'm like doing all the research, all the everything, like what's going on with my baby, and tongue tie came up. And so I don't know, I felt like it had to be possible. So I asked her pediatrician if she could check her. And I had also scheduled a separate appointment with lactation, and her pediatrician didn't feel a tongue tie, but lactation did immediately, which she ended up having a 3rd degree tongue and a 3rd degree lip tie.
Beth, let me get Beth to explain this, because a lot of moms on here may not know what that is and how to identify it. Beth, what can you tell us? How does a mom identify it?
So a tongue tie, so the little piece of skin that's under the tongue, the frenulum, can, you know, everybody has one, but it can be in different lengths and different thicknesses. And for babies who really need to actively use their tongue to, you know, grasp the breast, if it's restricted or held down, it can make it really challenging and difficult for them to latch. There's a doctor that I work with, Dr. Christina Smiley, who's very well known in the field of lactation at Breastfeeding Resources in Connecticut. And she always says that tongue tie and lip tie are both overdiagnosed and underdiagnosed. In your case, Victoria, it was underdiagnosed, that a lot of people are not trained to assess them well. And that overdiagnosed means if you have any problem, it's got to be a tongue tie. When sometimes it's just maybe a little tweak or a little change the way that you're positioning, or, you know, something that could fix it. But in your case, obviously, it really affected your baby. And unfortunately, there are a lot of people that are not well trained to assess and evaluate tongue tie. So I think the things that moms might notice early on, if it's a possibility, very sore nipples, baby losing suction at the breast really frequently, coming on and off and on and off, getting frustrated, maybe even spilling or struggling to feed with the bottle, coughing or choking. And that then can affect mom's milk production as well a little bit, because if the baby's not latching properly and causing pain, that can affect your production, which then affects her weight. And so that's why you saw her weight gain really slow down. So I'm glad that you found someone that was trained, and I'm glad that you listened to your instincts, because even as a first-time mom, you know when it's not right, despite all the experts saying, just keep doing it. I think you really, really have to dig down, and I'm so glad that you did, and say, it's not right. It's not right, and keep knocking on doors and calling people and getting referrals until you find someone. And I'm so glad that you did. So, yeah.
And Victoria, do you plan to breastfeed your new baby?
Yes, I do. I had, you know, high hopes for breastfeeding this one, but she's 97th percentile for weight, so she has no problems. But I do plan to have, it's a boy, so I do plan to have him checked for both tongue and lip as soon as he's born. Just being that, you know, we kind of feel like it might be hereditary. Like my brother and sister had one as well when they were born, and I think maybe I have one to a slight degree. Like my brother and I weren't able to breastfeed with my mom for more than like 6 or 7 weeks, and so I don't know, just some different things adding up. So it is possible that it could. Here comes the toddler tantrum, you guys.
Well, listen, we're going to let you attend to Hannah, who is adorable. Best of luck. We're sending our love to you and the new baby, and she is adorable. And thank you for sharing your story. I'd never heard it, and that's what's the power of this community, sharing the experience and helping others on the journey. So congratulations.
Thank
Bye,
you.
beautiful girl. Oh my gosh.
Bye-bye.
Bye.
Bye-bye. We have Natanya from Fort Hood, Texas, my neck of the woods, joining us. Are you there? Hi. Look at that beautiful Texas sun. You've got your hands full right now. A 6-month-old, and you're 12 weeks pregnant with your
13 weeks pregnant now.
And who's counting? You are counting, and you should be.
Yeah, and I just found out it's a boy again.
Oh my gosh, congratulations.
Thanks.
How was your how was your breastfeeding experience the first time around?
Well, I feel like probably any first-time mom, it was painful at first in the hospital and a few days after too, because both getting used to breastfeeding and stuff. My nipples hurt so bad, but I was like, I gotta stick through this and everything, and we did, and it was because too I had a whole lot of milk. I felt like they were hurting so bad I needed to pump just to get some out and everything, but it was good. So I mean, sometimes I feel a little bit like I have a chain to my boobs because he's always like, Mama, for it, especially at night. I'm like, I just want to lay down in this position. You stopping me from laying on my tummy.
I mean, because it's amazing. I'm so impressed that you are live on Zoom with a 6-month-old in that contraption in front of us, and you're 30 weeks pregnant, and it's got to be 300 degrees in Texas in that sun. So
it is pretty hot, but me and my friends wanted to walk to get some toys from summer Santa thing.
So cute. Well, and just get out and walk is a form of self-care. How do you find time to take care of yourself in the midst of all this?
Well, when he sleeps and stuff like that, I make sure and, get him a routine and put him down and do what I want during that time. Like, for me personally, I can't stand being in a dirty house. So I'm like, I try to clean in between that time, take a bath and stuff like that. And I take a bath with him too. So that makes it nice and everything. I feel like I can relax and do things with him whenever my husband's at work and stuff like that. And I try to get that time in between to do what I feel is necessary for me and everything.
Ronnie,
but sometimes I have to realize the house doesn't need to be clean. I want to be like that, super mom that, that has everything like perfect dinner on the table and stuff. But I'm like, well, this baby needs me right now, so I got to not worry about that and everything, and just, enjoy that time with him. And then when I have a moment, I sometimes watch TV or, take a bath or something like that to try and do that. And then when my husband's home, he'll help too. He sometimes will take the baby and let me nap.
That's a good husband. He needs to do that. Ronnie, let me bring you in because you have 10 self-care tips that you recommend. We're going to send out the list after the program, but you want to go through some of them quickly?
Absolutely. Kind of some of the basics. Hydrate, eat nourishing meals and snacks, move your body every day, get outside like 20 minutes a day, going to bed early, and resting or napping when baby is napping. Also, doing something that you love to create some time for yourself, connecting with your partner, talk about things other than baby. Other than baby. That's a hard one. Again, just sharing, what you love and appreciate about each other, letting go of the shoulds. I should do laundry, the cleaning, the cooking, the emails. They can wait. Focus on one thing at a time. Be gentle with yourself. Be flexible. Trust your intuition. We get bogged down with the day-to-day, and sometimes we lose perspective. So practicing gratitude, starting a gratitude journal, and you list 5 specific things that you're grateful for every day that can really help you feel more grounded, balanced, and, joyful. And also asking for help, as I've talked about earlier, is just so huge. So whether it's your partner, asking your friends or family for specific things like dropping off a home-cooked meal, walking the dog, doing the laundry, holding the baby so that you can shower. And then, of course, building your village. And that means reaching out to moms, but also, setting up consistent times to talk and meet with other mamas. But also that's your pediatrician, your doctor, your lactation consultant, a therapist, a new mommies group. And to be open and honest about your mothering experience, because those are the times that you can really feel connected and supported.
And I think Natalia just said it right. I mean, not feeling compelled to do everything in the house. One of the bits of advice I got from someone was, when the baby is napping, you nap. Don't use that time to try to clean the house and do all these things, because when the baby is napping and suddenly you're doing the laundry, you're washing the dishes, the baby wakes up and you have not had a break. And I'm a Virgo, and I love I'm the person who does the pillow like this, and now the pillows are like this, Natalia. I don't even care what the damn pillow is. You have to just at some point really take that advice that the disorder is order in a way. You know, it provides you the opportunity to get some rest. And I've accepted there's just gonna be toys and pillows and dirty dishes sometimes, and you got to live with it. So thank you. I'm happy she's going to get the toys and out of that hot sun, because that's a superwoman there. Let me quickly get to Hillary joining from Germany. Hillary, are you there? Hi, how are you? Hi. We don't want you to talk too loud. Looks like there's some napping going on there, or some resting. You just had your third child. The two first babies, you overcame breastfeeding challenges. Oh, there you go. There's a guest appearance from somebody. How do you describe this experience so far, your third time around?
It's definitely been a lot different than the first two. The first two, I feel like I wasn't as prepared as I have been this time. Doing it both the first two times got me a lot more prepared this time, and I knew more what to expect.
And what would you say from those two experiences to now, if you had to offer advice to a mom, now that you're kind of a pro, I guess I can call you that at this, is that sage thing to keep in your mind?
Definitely, if you need help, ask for it. If it's not going the way you think it should, there's lots of help out there, and I think that definitely helped me the first time around. There was a lactation consultant that really helped me the first time around, and then the second time I was a little more prepared, and then even the third time too.
And how long have we been napping there in your warm arms?
She just kind of fell asleep, and it's very warm here. It's like 90 today, and there's no AC, so it's pretty toasty.
Okay, well, we're not going to keep you. We just wanted to bring you on and celebrate your journey and the great advice that so many moms are just, I think just happy to hear, especially from someone like yourself. I don't know how you do it. You're there in the hot heat with the babies, but to look at that little angel in your arms is so comforting. So thank you so much for sharing your journey.
Thank you.
Oh, that is so sweet. Okay, so we're going to switch gears a little bit and talk about something that we all have, everybody on this Zoom, and how to support them while pregnant and afterward. And that is the girls, some people call them. Some people call them boos. Our babies call them the best friends and pillows and all kinds of things. And we brought Marla back from Motherhood Maternity. And you're an expert, Marla, in this area. I am still trying to figure out what happened to mine. And I think a lot of moms are doing the same. What happens to our breasts while we are pregnant, other than clearly increasing in size?
Well, I think what happens, and most people don't expect this, is pretty rapidly in your pregnancy. So very early on, you end up needing a new bra size, and your breasts grow pretty rapidly. And most people think that you would need a new pair of pants or something for the waist, but it's really the bra that is probably the first purchase that most people need. And what happens is that the women's breast tissue will increase by about 35%. So it just makes your breasts more dense and heavier, therefore needing a supportive bra. And what we know is that most women don't wear the right bra size to start with. So then this only becomes more challenging as you are pregnant and going through your pregnancy journey. As growth spurts happen throughout the pregnancy, you just need that support. And one of the issues that can happen as your milk ducts are forming early in the pregnancy, you want to make sure that you have that support so that they don't get clogged and you don't have any other complications. And a lot of women wear an underwire. We carry a seamless bra. We also carry an underwire bra. But a lot of women, as they're going through the pregnancy, and your breasts are heavier, just find that underwire very irritating and uncomfortable. And so we recommend our seamless nursing bra, which is super comfortable. And like the name, it has no seams. It's just a tube, and it's quite supportive.
8 out of 10 women, as you point out, wear the wrong bra size when we're not pregnant. I happened to, one of the many jobs I had in college, I worked at a lingerie store. We'll write about it in my book. But I definitely know that to be the case. Even knowing that, to your point, I remember going into a store trying to decide what maternity bra to wear. And I just felt like, okay, there were so many choices. And to the point of body image and what my body will look like after, and what's the ease of allowing access to my child, you know, all of these things were rushing through my mind. I read an article once that said the hardest thing that you will buy is a bikini, which I don't wear anymore, and jeans. That I challenge, because it is the bra if you don't find the right thing.
That is true. And what we suggest is that to figure out what your right bra size is. And as you're going through your journey, you may find that you need more than one size. What you wear in your first trimester may not be what you wear in your third, and certainly won't be in your fourth. And anyone who's nursing understands that when you first come home from the hospital, you're one size. A month later, you're a completely different size. So you're going to change as time goes on. But what we recommend is that you get a tape measure, and that you keep the tape level around the back and fairly loose around your body, and so that you can measure your bust. Mm-hmm. Secondly, to get the band size, you want to wrap the measuring tape snugly around your rib cage, so that just below the bust, so that you can get those two measurements, bust and band. Mm-hmm. Once you have your band size, we recommend that if the number is even, you increase it by 4 inches. If it's odd, you increase it by 5 inches. And then you take the difference between the band and the bust, and 1 inch would equal an A cup, 2 inches would equal a B, 3 inches would equal a C. And we carry all of this information on our website. But these are just some helpful tips while you're at home, not able to shop, not able to really go out, especially if you first come home from the hospital. A lot of women don't know if they're going to breastfeed, then decide they are, and then all of a sudden say, oh no, I don't have the right bra. What do I do? Right. What size am I? Right. How do I measure? All of those challenges come up. So we carry all the information on the site, and that's a pretty handy way to figure out what size you might be.
I love that. And I do want to share some awesome news before we wrap up in honor of military families and all the families joining us today. Have some discount codes. Yes, we love discount from Motherhood Maternity. Marla, tell me about the discounts and how people can take advantage.
Sure. So everyone joining the call today can save $10 off your $50 order, and just use the code USO MOMS, MOMS, and that's valid through August 17th. And then 24/7 on our site, we offer a standard 10% military discount. All you have to do is put your ID in, and ID Me verifies you, and you get the 10% discount.
Okay, there you have it. Get on in there, because let me tell you, you're going to need a lot of things, and you will need a good bra, and this is a good bra. Well, Marla, thank you so much. Thank you for that special discount. Beth, your great advice on this journey for moms joining us. Ronnie as well, we appreciate you, because it is about family. It's about our relationships. It's about, most important though, our mental health as moms. So I celebrate the work that both of you do, and we appreciate you joining us and being so candid with our moms. And thank you to all the moms who joined us from around the world today. We saw folks in the blazing hot sun, the Texas and Germany, it's all over. But most important, we're in this together. Our next conversation, September 21st, and we're covering work-life balance and a newborn. And that is going to be exciting, because that's September 21st. My new season of my show resumes September 14th. So I'll be back working and not balancing it, because I don't believe there's an answer to the balance, but there's a conversation that can be had, because we're not alone. There's not a one size fits all, just like bras. Life does not have a one size fits all. It's, as Beth said, as Ronnie said, not comparing yourself to others, but embracing the advice, the love, and the help that is available. So I am happy to be here with you. I can't wait to see you at the end of September. Thank you again for joining us. Enjoy the rest of your day. If that includes just having a nice iced tea alone in the closet without the kids, or maybe a foot soak, whatever it is, the simple things are what build up to the big joy that life is supposed to be for you and your family. So thank you all. Have a good day, everybody. Thank you, USO.
Thank you.